You know, there's something quietly devastating happening inside millions of bodies right now, at this very moment, and most people have no idea. They've never had a sip of alcohol in their lives, or perhaps they drink so rarely it barely registers, and yet their liver is slowly, methodically being damaged. Not by what they drink, but by how they live. By what they eat. By what they breathe. By what they carry in their blood. The liver, this extraordinary organ that performs over 500 different chemical operations every single day, is under siege, and the weapons aren't in bottles or glasses. They're in grocery carts and medicine cabinets, and even in the very fat that wraps around our organs. So let's talk about the things that are destroying livers in ways that have nothing to do with alcohol, because understanding this might just save your life. You know, there's something almost poetic about the way our bodies process sugar, except that in the modern world, this poetry has become a tragedy. When you consume sugar, particularly the fructose found in table sugar and high fructose corn syrup, something remarkable happens in your liver. Unlike glucose, which your entire body can use for energy, fructose can only be metabolized by the liver. It's like giving one worker all the jobs while everyone else stands idle. Your liver takes that fructose and begins breaking it down, and here's where the story takes a dark turn. The metabolic pathway that processes fructose is remarkably similar to the one that processes alcohol. In fact, fructose metabolism produces many of the same toxic byproducts, the same oxidative stress, the same inflammatory signals. Your liver, when flooded with fructose, begins producing fat at an alarming rate through a process called de novo lipogenesis, literally the birth of new fat. This isn't the fat you eat, this is fat your liver manufactures from sugar, and it doesn't just pass through. It accumulates. It builds up inside the liver cells themselves, turning them into tiny fat storage units. Now think about the quantities we're talking about. Our ancestors might have encountered significant fructose a few times a year when fruit was in season. Their livers could handle those occasional loads. But we live in a different world now. The average person consumes somewhere between 50 and 100 grams of added sugar every single day. That's in soft drinks, in flavored yogurts, in bread, in pasta sauces, in places you wouldn't even think to look. Your liver is being asked to process in a single day what it might have processed in a month or more throughout most of human history. And it's not equipped for this. Evolution doesn't work that fast. So the fat accumulates, and when more than 5% of your liver's weight becomes fat, we call this non-alcoholic fatty liver disease. 5% might not sound like much, but imagine turning 1 in every 20 liver cells into a fat droplet. The architecture changes. The function changes. And here's what makes this particularly insidious: fatty liver disease doesn't hurt. There's no pain signal. The liver has very few pain receptors. So this damage happens in complete silence while people go about their lives having no idea that their liver is slowly being transformed. The fat itself isn't even the worst part. It's what the fat triggers. Those fat-laden liver cells become inflamed. They start dying. The immune system responds, sending in inflammatory cells that cause more damage while trying to clean up the mess. Scar tissue begins to form, and scar tissue doesn't function like normal liver tissue. It just sits there, taking up space where chemical miracles used to happen. This progression from simple fatty liver to inflamed fatty liver to fibrosis to cirrhosis can take years or decades, but it's happening right now in millions of people who have never touched alcohol. We tend to think of medications as these benign helpers, these chemical allies that come into our bodies, do their jobs, and leave without a trace. But that's not how it works at all. Every single medication you take, whether it's prescribed by a doctor or picked up off a pharmacy shelf, is fundamentally a foreign chemical that your body must process, and that processing happens almost entirely in the liver. Your liver is equipped with an elaborate system of enzymes, particularly a family called cytochrome P450 enzymes, that break down these medications into forms your body can eliminate. But this breakdown process doesn't always create harmless byproducts. Sometimes, in the very act of trying to neutralize a drug, your liver creates something more toxic than the original compound. These are called reactive metabolites, and they can bind to liver proteins, damage cellular structures, and trigger inflammatory responses that kill liver cells. Take acetaminophen, something so common that millions of people keep it in their bathroom cabinets and take it without a second thought. At normal doses, your liver handles it reasonably well, converting most of it into harmless compounds that leave through your urine. But there's always a small fraction that gets converted into a highly reactive metabolite called NAFLD. Under normal circumstances, your liver has enough glutathione, a protective antioxidant, to neutralize this toxic metabolite. But when you take too much acetaminophen, or when you take it regularly, or when you take it while your liver is already stressed, your glutathione stores become depleted. And once that happens, NAFLD starts destroying liver cells directly. This is why acetaminophen overdose is the leading cause of acute liver failure in many countries. People don't realize they're overdosing because they're taking multiple products that all contain acetaminophen, a pain reliever here, a cold medicine there, perhaps a sleep aid that also contains it. The doses add up invisibly. But it's not just overdoses that create problems. Even at recommended doses, chronic use of many medications can cause what we call drug-induced liver injury. Certain antibiotics, antifungals, statins for cholesterol, some antidepressants, herbal supplements that people assume are safe because they are natural, all of these can stress the liver. The challenge is that everyone's liver is different. Genetic variations mean that some people process certain drugs more slowly, allowing toxic metabolites to accumulate. Some people have livers already burdened by other conditions, making them more vulnerable. And when you combine multiple medications, which is incredibly common especially as people age, you create unpredictable interactions where one drug inhibits the enzyme needed to process another, causing dangerous buildups. What's particularly troubling is how casual we've become about medication use. Popping pills has become reflexive, automatic. A headache appears and we reach for relief without considering that our liver must work to process that relief. We take supplements and vitamins in massive doses, forgetting that just because something is sold over the counter doesn't mean it's without risk. Your liver is performing an exhausting chemical ballet every time you swallow a pill, and sometimes. When we talk about excess body weight, we often think about the fat we can see, the fat that sits under our skin, but there's another kind of fat that's far more dangerous. Visceral fat wraps around your internal organs, infiltrates spaces between your intestines, surrounds your liver, and this fat is metabolically active in ways that subcutaneous fat is not. It's not just sitting there as stored energy. It's essentially an endocrine organ, secreting hormones and inflammatory molecules called cytokines that travel through your bloodstream like chemical messengers of destruction. These inflammatory signals reach your liver and trigger a cascade of damage. Your liver cells become insulin resistant, meaning they stop responding properly to insulin signals, which leads to elevated blood sugar and even more fat deposition in the liver itself. This creates a vicious cycle that's difficult to break. The inflammation damages mitochondria, the energy factories inside your liver cells, making them less efficient at burning fat. So fat accumulates even more. The immune system detects this cellular stress and sends in macrophages and other inflammatory cells, which release more cytokines, which cause more insulin resistance, which leads to more fat storage. Your liver becomes caught in a self-reinforcing loop of inflammation and damage. And because obesity often comes with other metabolic disturbances like high triglycerides, elevated blood pressure, and disrupted cholesterol levels, your liver is dealing with multiple insults simultaneously. What makes this particularly heartbreaking is that many people are working incredibly hard to lose weight, but the metabolic dysfunction caused by their fatty liver makes weight loss extraordinarily difficult. The hormonal signals are disrupted. Leptin, which should tell your brain you're full, stops working properly. Your metabolism slows down as your body tries to conserve energy. Meanwhile, your liver continues to deteriorate, and the only real solution is to break this cycle through sustained lifestyle changes that reduce inflammation and allow your liver cells to begin healing. There are viruses that announce themselves loudly, that make you dramatically ill so you know something is wrong, and then there are viruses that whisper. Hepatitis B and Hepatitis C are whisperers. They slip into your body through blood contact, through contaminated needles, through sexual transmission, sometimes through medical procedures that weren't properly sterilized, and then they settle into your liver cells and begin a slow, patient campaign of destruction that can last decades. Many people who carry these viruses have no idea. They feel fine. They go about their lives while the virus quietly replicates inside their hepatocytes, turning those cells into viral factories. The hepatitis C virus is particularly insidious because it mutates rapidly, constantly changing its surface protein so your immune system can never quite get a handle on it. Your body keeps mounting immune responses, keeps sending inflammatory cells to attack infected liver cells, and in doing so, your own immune system becomes the instrument of liver damage. This chronic inflammation is what ultimately destroys the liver. Every time an infected cell is killed by your immune system, scar tissue forms in its place. Over years and decades, this scarring accumulates, the liver's architecture becomes distorted, blood flow becomes impaired, and healthy tissue is gradually replaced by non-functional fibrous tissue. What's particularly tragic is that hepatitis C is now entirely curable with modern antiviral medications, yet millions of people worldwide don't know they are infected and therefore never seek treatment. Hepatitis B, while not curable, can be effectively managed with medications that suppress viral replication, preventing most of the long-term damage. But again, you can't treat what you don't know you have. These silent viral infections represent one of the most preventable causes of liver failure and liver cancer, yet they persist because they hide so effectively, causing no symptoms until the damage is already severe.